Welcome back to the WHHI-TV Daily News. With me now is Dr. Karen Joynt Maddox, and she is a volunteer expert with the American Heart Association. And I understand that there's some reports that have come out that are going to really talk about cardiovascular disease and how it impacts our society both economically and physically. So thank you for being here today. Let's start really with a little bit of a background of what cardiovascular disease actually is and what some of the risk factors are.
Yeah, thanks so much for having me. So cardiovascular disease is kind of a broad term, but it includes things like heart attacks, heart failure, stroke, and heart rhythm problems. So any problems really with the heart and blood vessels. And the risk factors for that are shared across all those. At the American Heart Association, we think about those as life's essential 8. So 8 things: high blood pressure, high cholesterol, high blood sugar, which is diabetes, obesity, not enough physical activity, not enough sleep, a poor diet, and of course, tobacco use, smoking or other forms of tobacco. Now, the good news is that a lot of cardiovascular disease can be prevented by really being on top of those behaviors and health factors. The bad news is that we're projecting we're going to have quite a bit more cardiovascular disease in the next 25 years.
Well, and it's my understanding that it is right now the #1 cause of death in the world or America. I'm not sure which one, but am I correct on that?
It is still the #1 cause of death. That's right.
Yeah.
And, we're estimating that we'll have some pretty big increases in this over the next 25 years. We're estimating that about 60% of US adults will have some form of cardiovascular disease or high blood pressure by 2050. And that's 184 million people with some form of cardiovascular disease or high blood pressure. We're also seeing increases in diabetes and obesity in young adults and even in children. So, the numbers are pretty dire when we think about that, that prevalence, that number of people with disease, and also the cost. But it's also a call to action. We can really do something about this if we sort of work on both individual and community level ways to keep us healthier.
That really is a huge number. It really is a surprisingly huge number. And so talk to us a little bit. You touched a little bit about how the demographics are changing. Tell us a little bit more about that, but also then tell us really how we can be on top of it so that we don't fall into one of those numbers.
Right. So it's really across the life course. So as we're seeing that the population is aging, the baby boomers are retiring, and as people get older, they do tend to have more cardiovascular disease. We're also seeing that the younger population is really diversifying, so a much higher proportion of people from minoritized backgrounds. And those two things working together are part of why we're seeing the increase in risk factors and in cardiovascular outcomes. So to do something about it, we need to think across that whole life course. So on the individual standpoint, how can we keep ourselves healthier, our families healthier? And then broadly, how can we make sure that people have access to care to get the treatment that they need if they do have high blood pressure, diabetes, high cholesterol? How can we really make sure that we're all taken care of so that we can all be healthier in the long run?
Right. And what are some of the things that we can do prior to, developing cardiovascular disease? What are some of the things that we can really in our lifestyle take control of? I know you went through those 8, but so we're talking about we need more physical exercise, we need to stop smoking. What are some of those things?
Yeah, that's exactly right. So if you smoke, do everything you can to stop. And if you don't smoke, don't start. And then eat healthy foods, get plenty of exercise, and get sleep. We really undervalue sleep, but it's such an important part of cardiovascular health. And then if you have things like high blood pressure, high blood sugar, high cholesterol, obesity, really know your numbers and stay on top of them. It's not fun to manage having high blood pressure or diabetes, but it's a lot better investment to take the best possible care you can of that so that you don't end up having more problems down the road. Those are all things that we can do individually. We can also advocate for things like healthy lunches for kids and more physical activity and all the things that we know can help us sort of communally, societally in the long run from a public health standpoint to really make sure that we can see these numbers not go where we're projecting them right now.
Right. Well, thank you, doctor, so much for being here today, opening our eyes to these risk factors and things that we can do to make sure that we're not becoming one of those statistics. We really appreciate your information today.
Thanks. Everyone check out heart.org to get all the details and all the stuff that we talked about. Thank you so much.
Thank you. And we'll be back in just a moment with more, so stay with us.